one. This is the Sourceseeker Hour, our 79th episode. I thank our guests for joining us to give us an update on all these different things happening in COVID. We hear today that it said that 77% of respondents to the poll said that the worst is over with. So there are things happening. The governor of Texas has dropped any mask mandate and has said it's up to the people. Then you have lawsuits going on, different things going on. And we're going to talk to our powerful guest about that. Dr. Echols, Dr. Odili, we're going to ask them to introduce themselves. We're going to start with Dr. Echols, please.
Well, good evening, everyone. I'm Dr. Sabrina Echols Sampson, and I'm a medical doctor here in Houston, Texas. I currently have my own family medicine clinic in Stafford. It's called Butterfly Wellness, located at 1250 Texas Parkway, Suite A1. Also work in the emergency room along with my colleague here, Dr. Odili. We work at Lifesavers Emergency Room. And this is where I actually do take care of patients with COVID-19 and treat patients with COVID-19. And we have 2 locations here, one in Tomball, one in Shepherd. And so I'm so excited to be with you tonight. Thank you so much.
Thank you very much. And as you introduce yourself, go ahead and go into the issue of what's going on here in Texas. You and I are both here in Texas, and there's so many different interesting things. And how should America look at that?
Well, what we know as of this week, Governor Abbott lifted the mask mandate in the whole entire state of Texas, stating that there's no longer, you're not required to wear your mask. I have my N95 mask here. This is what we wear in our clinics and hospitals. And we also wear, actually, I wear this over my mask, and we also wear these shields. But what he's saying that you no longer have to wear your mask if you go out in public places like restaurants, stores, etc. There's been definitely, I believe, the majority of the healthcare providers, such as doctors and nurses, are totally against. This is my opinion, and most of the healthcare providers I speak to are totally against the mandate being lifted. We feel like it's too soon, even though we see a small percentage of the hospital rates going down, decrease in hospital deaths. Thank God for that. But I personally feel like it's too soon to lift the mandate. So there's a lot of conflict here in the state of Texas with city like Austin. I believe one of the mayors here in Texas, I believe it's the mayor in Austin, is suing Governor Abbott for lifting the mandate too soon. Correct me if I'm wrong. It's been challenging to keep up with all the challenges, all the changes.
I think, from what I understand, the Attorney General has sued the Austin mayor because he's instituting his own mandate in Austin.
Okay.
I think that's what it is.
Okay.
I think that's what's going on. It's very confusing.
Yeah, I remember I heard somebody was suing somebody over the mask. And I don't think it is so detrimental to people's health to wear a mask. It's not difficult for people, to go places and cover up their nose, cover up their mouth, and put a mask on. I can still talk to you, with this mask on. But what I don't feel that it is over. We're still dealing with many patients with COVID, even though you don't hear it on the news, we have variants. We have new variants here in our country. We have the UK variant. We have the variant from South Africa. We have a variant from Brazil and other variants. And so
and the mayor just said that we have 5 here in Houston.
5 variants here.
Yes, 5 variants.
So why would anybody in their right mind, I'm saying that, why would anybody in their right mind lift the mandate now when we have these new variants and we really don't know, we don't have the data to know if the vaccines that people are receiving are going to be against all of these variants? We don't know yet. There's so much we don't know. So why wouldn't you want to keep the mask mandate for at least another couple of months until we get more data, until you get more people? From what I understand, this week we only had in the state of Texas, maybe Houston, 9% of the people vaccinated in the state of Texas. 9% of the people vaccinated, and you want to make a judgment call on 9%, not 25%, not 50%, but 9% of the people have been vaccinated. I think in the country it's been over 25% of the people vaccinated in the country. You know?
Yes.
We are not out. I mean, I've been praying that we do not see a spike in hospitalizations and deaths. But the experts they already predicted with us lifting this mandate, and other states are following, that they're going to be deaths. They're going to be, unfortunately, innocent people are going to die because of this, mandate being lifted.
And what you said earlier, we really do not know about these variants. What's the effect of the variants that are going to have on Modurna and the Pfizer? Are those going to take care of them, or is the variant beyond that? Let's let Dr. Odili in. You've heard our conversation. 77% of the people say that we're past the worst of it. Do you agree with that? And please introduce yourself.
Well, good evening, everybody. My name is Dr. Russo Odell. I'm a board-certified family medicine physician practicing urgent care at Apex Urgent Care Clinic. We have 2 locations in Houston. And then I also practice emergency medicine at a few emergency rooms around town, including Lifesavers Emergency Room. I've been practicing, I'm Houston born and raised, so I've been here almost all my life, and definitely proud to be a Texan. Very not proud about the governor's decision. It is not based in medical science. There's no medicine behind the date that he chose. As a physician, I'm not wholly concerned with public opinion about whether or not the worst is over. I concern myself with what the science says. Now we can learn from the past, or we can learn from evidence-based medicine, but I don't take medical guidance from layman's opinions, unfortunately. So whether or not people feel confident about the future and feeling like the worst is behind us is irrelevant. What's relevant is that the virus is actively taking hold in people, thousands of people daily. And what that allows for is mutation. So the more thousands of people that get infected, the more chances the virus gets to replicate and mutate and form variants. Now, these variants have not been seen before. Every time it happens, we are rolling the dice on whether or not the vaccine is going to be effective. We just don't know yet. So at some point, there will be a variant that the vaccine is not effective against. And we are going to be in a situation just like when we have a new flu and the flu vaccine is not effective. So we are going to be walking toward the situation where we're going to need to do a booster vaccine every year in the same way that we do a booster for the flu, because the mutation is going to be an ongoing process. So I would say the worst is not behind us. Things may look better this year as we get vaccinated, but there will be a new variant that emerges at some point in the next 5 years that is going to require the entire world to be revaccinated.
There's not enough information told about the variant and what you just said. You just said that we're going to have to get revaccinated. You said that there's going to come variants that we're not going to have a vaccine for. And we're probably going to have to get a booster every year. Am I correct in what I said?
Yes, you are you're summarizing what I just said to you. Yes.
That is in some ways disturbing, and I gotta tell the truth. I don't think enough people have heard this. And we're in a new world. We're in a new world that, first of all, wearing masks is going to be permanent. Wearing masks is going to be permanent. Social distancing is going to be permanent to a certain extent. Handshakes are going to probably go away. Dr. Echols, what's going on?
Well, I think, with this novel virus, COVID-19 is a novel virus. It's not the first coronavirus. We still have other coronavirus. And we do know that people have been reinfected with coronavirus, even with COVID-19. We've had multiple people, we know multiple people that have had COVID-19 twice now. One nurse 3 times. And that's because of the variants. And so if you study the behavior of a virus, this is a normal behavior. It's normal for a virus to mutate when it replicates inside of the cell. And so maybe people might not understand, what are they talking about, this variants? Are they making these things up? No process of this virus. It can get into your multiply, and while it's multiplying, it mutates in the genetic coding. This is an RNA virus. And so those that are experts in virology and virus virologists, they already knew that as soon as we heard we had a pandemic and it's a virus, an RNA virus, they already knew it was going to mutate. So trying to explain that to the whole entire world while we're dealing with a crisis of trying to stop the spread of it, trying to tell people, oh, this virus is going to mutate, and by probably next year is going to be another one. So we already know from influenza, other different types of viruses, coronavirus, SARS, that it's going to mutate. So now we're trying to get ahead of all these mutations. And one of the things is with the vaccines, the experts are saying it is very likely that the vaccines will protect you from the variants. So let me let the population know this. The main reason for the vaccine is not that you might not ever get a virus, get infected with COVID-19. The main purpose for you to take this vaccine is to decrease hospitalization and to decrease the percentage of death rates. Okay? So really, this vaccine is supposed to help reduce the chances of acute respiratory distress syndrome, you ending up on a ventilator and you dying. So severe cases. So the makers of the vaccine, they're not promising that you may never get this. But what they're saying is, if you take this vaccine, whether it be Moderna, Pfizer, Johnson, whichever one you get it, okay? If you have underlying conditions, if you are immunocompromised, you are at high risk from getting this virus and dying. So the makers of the virus are saying, okay, our studies show, the studies in Juhnson Juhnson, Modurna, and Pfizer show that nobody in the study got a severe disease from COVID-19, and nobody ended up dying, hospitalized or dying. So that's pretty significant. Nobody ended up with severe, they didn't say nobody ended up getting it. They just said nobody ended up getting severe disease and no one ended up dying, okay? We know that Moderna is 2 shots, okay? 94% effective. We know Pfizer is 2 shots, 94, 95% effective too. Johnson & Johnson is 1 shot. In the United States, 72% effective. Worldwide, 62 to 66% effective. We know that Johnson & Johnson study was a little bit longer because they were actually doing studies in other countries where we had the variants. They did the study in the UK. They have people that were in the trial in the UK. They enrolled people in South Africa and the UK. So the Johnson & Johnson vaccine actually did help people that actually had the variants. We already know that because they were in South Africa. They were in UK. And so Moderna and Pfizer did not test people in those countries. They can't. Their population was here in the United States. Okay. So when people are trying to compare these vaccines, there's no study that compare all 3 vaccines. There's no study that compare. You actually have to look at the data individually. You know, Johnson & Johnson, people look at the percentage, but you got to look at, did it stop people from dying? Did it stop people from dying when they took? Did it stop people from getting in the hospital? So I'm still taking care of people who were diagnosed with COVID back in the fall that still can't go to work. They're having problems breathing. They have problems walking. They're having problems with their memory. They're having problems with their lungs. They're problems with their heart. I'm talking about active people that was walking around, going to work, taking care of their family, doing everything, but now they can't even go to work. So I'm like this. I don't want you to go in the hospital, number one, and I don't want you to die from this virus. So the chances are better for you to take the vaccine. Not to say that you might not get the virus, but if you do get the virus, it may be a less severe case, and you may not end up in the hospital or on a ventilator or dying. You can't look. There's no study to compare all three.
Let me ask this question, Dr. Odili. Given that, okay, we're at 1,500 a day, I heard today passing. And given the fact that COVID in some form or fashion with the variants or some form of fashion will be with us for a while, will it become normalized a certain rate, for instance, 1,500, will that become normalized and basically people go back to normal and say, okay, we just got to accept this and move on?
So the question about where is the bottom, where is the floor for the death rate, that is going to depend on what percentage of people get vaccinated. if we imagine a situation where 90% of the country is vaccinated, we are going to reach a place in time when there's going to be 100 or less people passing away. But if we hang around at 50% or more that don't want the vaccine, including children, then we're going to see the virus continue to spread, and we're going to see death tolls in the thousands until that vaccination rate improves. And again, when variants emerge years down the line that make the vaccine ineffective, then we're going to see, new waves of infection. The vaccines that are out now are going to be effective at preventing death and the variants that we see now, but the variants that we have not seen yet, we cannot predict that yet.
So do you approve mandating the vaccine? For instance, teachers, other professionals, it should be mandated as a part of their employment?
So I believe that medically we're going to reach a point where the COVID vaccine is going to become part of the necessary vaccines, like chickenpox and measles and mumps. We're going to get to that point for the children. In terms of the workplace, I don't know where I stand. I mean, from a health standpoint, I recommend everybody get the vaccine. So that's a no-brainer. Making it law is politics.
Okay.
So I'm not a politician. I don't have a vote on that yet.
But you did say that if 90% got the vaccine, then the death rate may go down in the low hundreds.
Yep, that's my belief. And medically, I believe that everybody should get the vaccine who is approved to get the vaccine at this stage, ages 16 and up.
Okay.
And I want to add what Dr.
Yes, ma'am.
is saying is that if you can stop the spread and get the death rate down, then even with the variants, if you have an outbreak that happened, an epidemic that happened in Utah or something that jumped off in Minnesota, then now, just like when the measles epidemic started in New York, now you have a small epidemic outbreak where you can send your forces to New York, or you can send them to Minnesota or Alabama. But now it's the whole entire world is on fire. The whole world is on fire. So we have to do something to decrease the amount of hospitalizations and death. And then in the future, if you start to have the outbreaks, we got to be more proactive to have contact tracing. If an outbreak happened in Iowa, okay, what team is going to go there and quarantine those people and do contact tracing and get it under control? This probably going to be going on for forever, but at least you got to get the death rate down. We have had I'm just talking about the United States, over 530,000 people died. And President Biden going to be talking about this tonight he's going to be speaking about that. I think this is a very important time for us to listen to what the president is saying. More people than World War I, combined with World War II, combined with the Vietnam War, combined with 9/11. There's more people died in 1 year calendar. 365 days in the United States is the number one cause of death now. It surpassed cancer. It surpassed heart disease. So people have to understand why in healthcare that we're encouraging people to take the vaccine. If they decide they don't want to, I believe people have a right to decline.
Okay, because I was going to mention, you have so many people that are anti-maskers, anti-vaxxers.
Right.
There are the politics of it that Dr. Odili mentioned, yes, there's a lot of people that are adamantly against it. So it may not be an opportunity unless something changes to get at the highest rate of 90% because so many people are adamantly against it. So that's why I mentioned the normalization. Will it come to a time of it's normal because we can't get beyond a certain rate of vaccination? Dr. Echols, what do you believe about that?
I do believe that in order for you, and I think it's going to be prevalent in other countries, in order for us to travel to other countries, they very soon are going to require that we have the vaccine. Once you have a certain amount of population worldwide to receive the vaccine, if I want to travel to Europe, if I want to go to Paris, they're going to say, okay, do you have proof that you have the vaccine? Right now, people come to our emergency rooms and they have to get PCR testing to travel to other countries, or else they won't even accept them. So what do? What if a person is say, I don't want to wear a mask and I'm not getting tested? Well, you're not going nowhere because the plane, the international air flights are not going to take you. Trust me, we've had patients in the airport turned away because they didn't get a PCR test or they got an antigen test. They didn't get the right test. So whether or not you want to wear a mask, whether or not that you want to take a testing or get a vaccine, if you want to travel, if you're a business person and you need to travel, if you want to take your daughter and son to college, your kids in college gonna have to get tested to play sports. I know because I'm working with Texas Southern right now they're gonna start their COVID lab right at Texas Southern University here in Houston, Texas. So if you want to play basketball in NCAA, you're gonna have to get a COVID test. And so you can't force people though to take a vaccine. A COVID test is different from a vaccine. So you can't force people unless, say for example, like Dr. Odili said with the children, unless it's a mandate with the American Pediatric Association that in order for your kids to go to school, they have to have their immunizations or else they can't come to school. So we haven't heard that yet. We haven't heard that it's going to be a mandate for them for the kids to get the vaccine because they just started entering the kids, the younger kids. We know 16 and up, but the younger kids mandated. Should it be mandated for the teachers? If the teachers want it, I think the teachers should get it first too. They should be on the front line too, just like healthcare workers, teachers, essential workers. They should get it if they want it. If the teachers decide they do not want it, and the city or wherever they live is requiring it, and then they say, for example, what if a teacher said, well, I'm allergic to vaccines and I did this happening, they may have to get a doctor's note to excuse them from getting a vaccine. That has happened before. If a healthcare provider wants to work in a clinic, a hospital, emergency room, urgent care, and their boss demands that they get a TB test or vaccine or virus, and they decide they don't want to, they may have to sign a waiver saying that if you get infected with COVID and you die, it's not our fault. People sign waivers all the time. If this happened, you're taking a risk and you may die, it's not our fault. Or they may say, if you decide not to get the flu vaccine or the COVID-19 vaccine, then you can't be employed here. This may not be the job for you because of the risk. So
let me ask this question. Previously, I know COVID was mostly among the elderly. How has the demographics changed? Have they changed? What are the numbers on that, and what is the prospect of the future? Does it affect kids? Has the research been established on how it affects kids? Dr. Odili.
So if you imagine a situation where you're driving and then the light comes on for your air pressure, and you check that tire and you find out that it says the tire pressure is low. You decide to check all the tires, and then you realize that the pressure was low on all 4 tires. So in the past, we were saying that it was affecting the elderly more, but in reality, the virus has been infecting all ages. The difference is the elderly have been in the hospital more. The elderly have been passing away more. They've been losing their lives more. So I don't think that there's a big difference between then and now in terms of the age breakdown on who's getting COVID. And there hasn't been a change in who's being hospitalized. It's still primarily elderly, and who's passing away. So all those patterns have not changed. They'll change once people get vaccinated. Then we'll see a different distribution. If we vaccinate all the elderly, then we may stop seeing elderly in the hospital. If we vaccinate all the children, we may not see children, in the pediatric ICU. So the vaccines are going to change the distribution of the infection. And that's going to, like Dr. Echols is saying, we are encouraging everybody to get vaccinated so that we can keep y'all alive. One of my coworkers lost his dad. One of my best friends lost his mentor. One of my neighbors lost 3 family members. People are still dying from this disease. It is not a hoax. It is not a scam. This is not a game that we're playing. We just want to keep you all healthy and safe. So please get the vaccine. Doesn't matter which one. All 3 are effective at keeping you alive. So definitely, again, please get vaccinated as soon as you can.
Yes, very important. As a teacher, we want to have an environment that we are believing is safe. And of course, as you hear, there's so much conversation among teachers. We say among ourselves, well, we should have got a stimulus if we're so important to the economy, so important to opening our schools and so forth as we are. We are just as important as all the other industries in that, and some would say more so because we teach our young people and so forth. But one of the things with the stimulus is it has a part for the educators, but we didn't get our own stimulus. I diverge on that, but it's supposed to help the educational system, and 1.9 million, and it's a lot of things to help the economy. A lot of people lost their job during the COVID time and still are out of work. So those benefits are supposed to help across the board. And as Dr. Echols said, the president is going to come on and explain some of the benefits of that program. What do you see as the possibilities of the stimulus and the possibilities of how it can help the fight against COVID, Dr. Odili?
So the stimulus does have money earmarked for school systems, but I believe that money is going to be distributed by state by state basis. So if you have a state where the leaders are in touch with reality, then they will probably use the money to bolster the school's ability to defend against the virus, either with more protective equipment or by making sure vaccines make it into the teachers' arms. But if we have governors like ours that want to put businesses first instead of people's lives first, I don't have any faith that that money that's supposed to go towards schools, is going to end up doing what it's supposed to. So it really depends on the execution. So the national government has put money aside, It's going to distribute it state by state. And then we have to count on our elected officials to make the right choices. So these are one of those reasons why people say it's important to participate in elections every year. It's important to elect local officials who have your best interests at heart, because these decisions, they start at the federal government, but they trickle all the way down. And it's the people that you vote for on your little ballot in your county that make the decisions as to whether.
Your volume went out for a second there, Dr. Odili. Dr. Echols, let me shift the conversation just a little bit. What is the future? I already mentioned, I think, that masks are here to stay, social distancing, less gathering, but certain things are going to come back because the sports teams want fans in the building. How are they going to make that happen with stadiums 50,000 and more? That's such a big, but I do believe that things are going to change. What do you see as some of the changes that are going to be permanent and are coming or are already here?
Well, we're definitely prayerful that we will get a grip on this pandemic and be able to go to concerts, go back into the sports arena with the crowds. And there's going to be things that stay permanent. I believe people are still going to, when you enter places, sanitize your hands, basic hygiene, things that we should have been doing, all along.
Like those little wash stations, like we have at my job. They're going to have more of those little wash stations where you can just spread soap on your hand real quick and wash it off and clean your hands like every 30 yards or every 50 yards or something like that.
Right. And I believe in certain institutions like coming into your clinic or ER, hospitals, you're still probably going to have your mask because we have other diseases too that are highly contagious. Such as the flu virus, adenovirus.
I think masks are going to be permanent in restaurants from now on, any place you eat.
Right. Well, some restaurants are lifting their mandate. Yeah,
I bet you money you might lose that bet, my friend.
You think so?
Yeah, some restaurants are saying, no, you don't have to wear your mask. Some, even here in Texas, they were already talking about it on the news. They're saying you can come, and I don't eat in restaurants right now because I prefer curbside or takeout, and I don't feel comfortable taking my mask off in restaurants, knowing what I know, knowing what I know and who I'm taking care of. I don't feel comfortable because people come to work sick. You put people in quarantine, they don't stay in quarantine. People go out to weddings and funerals sick and they know they sick. People go to restaurants sick. Okay? They'll cough on your food. So let me tell you something. Trust me, and when I tell you, and Dr. Odili can testify, we have taken care of many people with COVID, many people sick, and many of them in the restaurant industry, many of them bartenders, many of them work at every grocery store you can think of. We have put them in quarantine. Some don't stay in quarantine like they're supposed to. As a matter of fact, they infect all their family members, and then all their family members come to us. We put them in quarantine. They're all positive, by the way, when we put them in quarantine. And they feel like, I'm not kidding, 5 days later, they're like, they'll come right back to us and say, test me again, I feel better. They're still positive. You test them again, you're still positive, sir. You're still positive, ma'am. Okay? Oh, really? Because I want to go to work. But you're still contagious. You can't go to work. So this is why we're having a problem too with the spread is because of people behavior, the lack of discipline that people have over their life. Okay, we're talking about vaccines and we're talking about this, but let me tell you something. I'm having problems with people lack of discipline over their life. That you can't stay out of a club over 10 days. I mean, you so anxious to get back to partying and going out, going or jumping on a plane and going to Miami, or jumping on a plane and going to the NBA All-Star game, and you're sick. You got a fever, you got a runny nose, and you anxious to go to the All-Star game, which was last week in Atlanta. So we're going to get that surge in another week. So I'm just saying that people don't want you to tell them what to do.
For sure.
Doctor, I've been a medical doctor over 20 years. People don't want you to tell them what to do. They want you to come in agreement with something when there's something coming against their life. When something comes against their life, they want you to be like, is it okay for me to drink 5 drinks tonight? Is it okay for me to smoke marijuana? Is it okay? No. I'm trying to tell you, this is not good behavior for you. It is not good behavior for you to be sick and go into restaurants, for you to sick and go into your workplace. It is not a good behavior. Just like I'm going to tell you, I don't want you drinking, smoking marijuana, smoking nicotine, and drinking 5 drinks in one night. I'm going to tell you the truth. Now, I'm going to also tell you about COVID. Your behavior is out of order. Your behavior is putting you at risk for getting COVID. And one of the things Dr. Odili can test about this, the people that are also in the hospital, many of them are obese. Obesity attacking African Americans and Hispanics at higher rates. And so when I tell patients, we got to lose, I'm telling myself too, we got to lose weight. We got to get our weight down. We got to start walking. We got to start doing this, the behavior, lifestyle. What do you mean, doc? Cut back on my salt. What you mean? What you mean I'm eating too much pork? What you mean I'm eating? I'm telling you, people that are dying in the hospital, this is the report we're getting, low obese and low vitamin D. These are many Hispanics that are obese, morbid obese, body mass index over 40. Obesity is body mass index over 30. Come on, let's put everything on the table. If we are too big and we're so worried about what we're going to eat all the time and what restaurant we want to go to and when we can wear our mask. No, let's look at the fact. The people that are dying are obese, and the doctors are saying that their vitamin D is low. Their vitamin D is low. Their immune system is low. They don't have cancer. They may not have even diabetes, but they're not taking care of themselves. They're not taking care of themselves. So we got to get back to the basics. If we are going to fight this virus, we got to boost up our immune system. We got to take vitamin D, vitamin C, your elderberry, your zinc, whatever it is you like that's going to help. Vitamin
exercise.
D studies. So many studies that show how vitamin D is helping your immune system, help fight off COVID. Quercetin, supplement, melatonin. Look up the supplements that are helping treat COVID, prevent COVID, that people are really be successful. But the thing of it is, what I'm having a challenge with people behavior. That's what I'm having a challenge with. Okay? And discipline themselves. And so people want to argue about a vaccine, but you won't even take your supplements. You won't even control yourself or wear your mask when you're in public, wash your hands, practice distancing. Is that really hurting you? Is it really hurting you to practice your distance, wear a mask. Is washing your hands gonna hurt you? It's gonna help you. And so this is what we're trying to do. We're trying to help people become more aware of their own lifestyle and their behavior so that they can have permanent lifestyle change. Just like this pandemic, we got COVID we dealing with. What are we going to be dealing with in the next 5 years? It might be a whole nother pandemic. So this is not going to end. We have to look at ourselves individually.
Yes, I totally understand. And the health thing is an ongoing thing, especially in our community. Mental health, you must talk about that too, especially at this time. Mental health within the Black community has been difficult across the board. And we've always had some difficulties with taking care of ourselves as far as health-wise, obesity, eating right, not smoking as much, not drinking as much. And we've always had difficulties, but we can improve. And that's a part of the thing that we need to do across the board, health-wise, mental health-wise also. Dr. Odili, the future. You said that you would take that bet with the restaurant. Are we talking about the employees of the restaurant, or are we just talking about, of course, we're going to take off the mask when we eat, but most people are still going to take the mask into the restaurant and then put it aside when they sit down at the table. So what are we looking at, and what is the future across the board of COVID?
Well, I would bet money that the majority of guests will not walk into a restaurant with a mask on, at least in Texas. They may behave better in other states, but I would bet good money that in 2 years, the majority of guests in a restaurant will not walk in with a mask. It's going to vary on the staff.
Your mute button on, Dr.
But I feel we're, the same people who smoke, even though they know it's not good to smoke, the people who drink in excess, even though they know it's not, healthy to drink, they're going to be combative against these lifestyle changes like they always have been. We give patients advice to improve their lives. It's up to them to take it or leave it. But we know far too many leave it. They leave the advice on the table.
Yes. So, that has always been the challenge. Self-discipline within our community and across the board. America is one of the most obese countries from my understanding of research. And it's a challenge. We do have one of the best health communities in the world as far as doctors and so forth, but we still have an insatiable appetite that we have to manage, especially in the Black community. That is one of the ways that we can improve. We improve that one step at a time, and we can do better. And this is the Sourceseeker Hour. This is our 79th episode. I'm your host, Baruti Carl Alexander. We have gotten toward the end of our show, and we're going to ask our guests to give a final statement and how they can be reached. And we thank them very much. We're going to start with Dr. Echols.
My name is Dr. Sabrina Echols, Butterfly Wellness. We're at 1250 Texas Parkway, Suite A1. Our office number is 281-969-5601. My website is drsabrinabutterfly.com. You can go on, make an online appointment if you need to. I just want to encourage everyone to hang in there, to continue to wear your mask, even if you go to places and they tell you you don't have to wear your mask. I highly recommend you still wear your mask, continue to wash your hands. I always say physical distance. is important because we're now dealing with 5 new variants. That means that the virus has mutated, and variants don't respect borders. Variants do not respect borders. We need to be more proactive. I do recommend that if you have underlying conditions, you're on a front line, essential worker, teacher, that you have underlying conditions, immunocompromised, that you should talk to your doctor to get vaccinated. I also want to let you know if you've been diagnosed with COVID and within the last 3 months, then they're saying that you have to wait until after at least 90 days to get vaccinated. Because I'm getting a lot of calls from people who were positive for COVID, and maybe they didn't go in the hospital, maybe they had a mild case, and they want to know should they get the vaccine. So you do have natural antibodies. We don't know how long it's going to last, but the experts are saying to wait until at least 90 days. Okay. There are 3 vaccines out now. Okay. Pfizer, Modurna, and Juhnson Juhnson. Okay. There's no study to compare them against one another. All 3 are showing to prevent hospitalizations and death. They're preventing hospitalizations and death. Okay. And so I want to make sure that you understand that. It doesn't mean that you may never, ever have a COVID. If you do, it may be a very mild case, but at least we know that the vaccines have prevented severe hospitalizations and deaths. So I want you to continue to take care of yourselves, take your vitamins, and make sure that you take time out for yourself. Take time out for yourself, okay, and your family. Take care of yourself, okay? All right, that's all I have to say.
Thank you very much, Dr. Echols. Thank you very much. We certainly appreciate it. Dr. Odili, your final statement is what you would like to tell the audience, and then how they can talk with you.
Sure. So my final words tonight are going to echo Dr. Echols in that everybody should do their very best to get the vaccine. The vaccines are safe. They are effective. The primary goal is to keep you out of the hospital, keep you well and healthy. So everyone who's eligible should go ahead and get that. We, as a nation, as a state, as a city, we're counting on each and every one of you to do your part. Wear your mask in the appropriate settings. Social distance when you can't wear a mask, and get the vaccine and continue to vaccinate. If a new booster comes out in a couple of years, get that. Don't feel like the single shot is going to take care of you for the rest of your life. If they recommend a booster, you should please get a booster. My Instagram is erdro. You can find me there. apexurgentcare@gmail.com is the email. That's the name of the clinic as well. So definitely reach out if you have any questions. Thank you.
Thank you very much. This has been a very, very informative show, and we're going to continue this series March 25th. We'll see if we have any updates, any more information. The name of the show is an update on COVID. We've had Dr. Odili, Dr. Echols, very informative. We thank everybody. We'll be back in touch with you next week, the Sourceseeker Hour. I'm your host, Baruti Carl Alexander. Thank you, everybody. We'll see you next week. Take care.